I think the importance of OPTIMISMM is really that it's a pomalidomide regimen that's clearly increasingly relevant in relapsed myeloma. So the OPTIMISMM trial was pomalidomide, Velcade, Dex against Velcade, Dex. And specifically at BSH, it was looking at first relapse in particular. There's an increasing recognition, I think, that pomalidomide will probably be third line, used more in the UK. And clearly it's a very active regimen. It improves, it has synergy with Velcade, greatly improves the PFS. And importantly, I think it's also in a group of patients who've already had Velcade as well. And there wasn't a huge difference between those that had Velcade and those that hadn't. And it's really very relevant for the UK because it's likely that it will be an option for us at some point in the future. And increasingly, we're going to be using daratumumab, len, Velcade first and second line, and therefore what we use third line is going to become a bigger issue for us, I think. And so having access to regimens like this is really important. The third line and fourth line will become increasingly challenging, particularly as daratumumab moves up front. But there are some interesting combinations. So pomalidomide and elotuzumab is one, which may well go forward because it's the same drug company, it's Celgene, and they may well push that through NICE. And then we've got isatuximab as well. But we've already got quite a lot of experience with pomalidomide in patients who've failed len, going back 10 years probably, maybe even longer. And we know that a proportion of those patients do respond quite well to pomalidomide alone. So when you use it in combination with another agent, I think that's quite a reasonable approach, third or fourth line.